Welcome to Side Effects, effect versus affect. It's hard to know the difference. At McGohan Brabender, our goal is to provoke you to think differently about employee benefits, your employees, and the status quo. That's why it's Side Effects with an A. Join me, Kenzie McEvily, and one of the industry's brightest guests to dive deep into the process of good employee benefits. Let's get started. During the final months of 2021, many employed Americans found themselves at an all-time low. According to the U.S. Census Bureau's Household Pulse Survey, 47% of adults reported symptoms of anxiety, 39% reported symptoms of depression, and 1 in 5 adults disclosed suffering from a mental illness. Even with these extreme statistics, it's estimated that less than half of Americans with a mental disorder get the treatment they need. So now what? MB Population Health Manager Tiffany Kuck is our in-house mental health expert. In this podcast, she shares tips for employers on how to support their employees and how to choose the right mental health crisis solution for your workforce. Without further delay, welcome Tiffany to the show. Hello, everyone, and welcome to Side Effects. Dave, thank you so much for joining me today.
It's great to be here.
And we have a special guest in the house, Tiffany Kuck. How are you?
Hi, hello, and good morning. I'm good.
Yep, and she is our Population Health Manager here at MB. And we were just talking, we've been trying to get you on this podcast for 9 months now. And I feel like mental health is in the forefront of everyone's minds.
Yeah.
So Dave, actually, can you set the stage for us? Why are we doing this podcast today? Why now?
Yeah, so to take a step back, our team strategy and innovation and health management EHL here have really started working closer and closer together. And it makes total sense because we really come at it from the how do we get people to do what we need them to? How do we get them to engage their healthcare, be better consumers? And then Tiffany and her team, they're the solutions people.
Right.
So we're like PBJ here, we fit together. So one of the most recent projects that we worked on together was Tiffany sat down because when account teams go out, when Tiffany goes out, it can be a really overwhelming topic, mental health, because you can go to it from a million different directions. Everybody has a different access point depending on the plans and programs they have in place, depending on what they want to do, what they're capable of doing, the demographics of their workforce, how much they want to be involved or not be involved. And so when we sat down, Tiffany was like, well, we were whiteboarding, and she's like, I kind of put things in different buckets according to point solutions and access points that are out there. And as she went through it, I was like, you've just taken a very complicated subject and you've made it very easy,
Simplified.
very easy to understand. And so through the conversation, we started developing pieces, and we're like, this would be a great podcast to share with employers that are out there so they can really take something that can be complicated and overwhelming, and how do you break it down and simplify it? And so who better to bring on and talk about it than
The master herself.
yes,
Right.
Yeah.
So Tiffany, what are you hearing from these clients when you're meeting with them? Can you share some statistics and the requests that they're looking for?
Yeah, sure. So some quick stats before I go into the different requests are that 85% of mental health conditions are undiagnosed or untreated. 71% of employees say having support for mental well-being at work is and will be important to them now and in the future. 24% of employees have taken time off because of stress and mental illness, and 37% of those employees feel uncomfortable discussing mental health with management. So when all of these stats really started to come out, employers knew that they had to find a solution, but they didn't know what that solution looked like. So they would come to our team and say, hey, we need a mental health solution. Well, just as you said earlier, mental health is such a broad topic. Like, what kind of solution do you want to look for? Is it that you just want to provide resources to your employees? Is it that we want to dive a little bit deeper and make sure that there are actual on-call options? So that's where the decision to break that down into 4 different buckets really started to come from, and how do we now guide employers to help them understand, okay, bucket 1, bucket 2, bucket 3, bucket 4, and then everything below each one of those buckets.
Right.
So, Tiffany, how long have you been in your role here?
9 years.
Okay. And in the 9 years, was mental health on your radar?
I would say maybe about 3 to 4 years ago, it started to become a hot topic. And then COVID hit and it became the topic. Yeah.
Yeah. So it definitely, I think when we surveyed our employers, we found that mental health and the mental well-being was their number one concern relative to the benefit program that was out there.
Yeah, absolutely. And really it has been put on employers because they see their employees day in and day out. They see them sometimes more than their family life sees them. So employers feel the respect and need to be able to provide these resources to their employees.
Okay. And so the buckets that are out there, from like least invasive, or I guess kind of, I'm just putting my toe in the edge of the pool to see how it is, to we're all in, all hands on deck. What is that? How's that stair step? What are those?
Sure. So that bucket 1, that least invasive, but it is something, it's a tool and resources. I would call that the point solutions. So really those are like self-guided solutions, apps, something that an employee can access through their phone, just quickly do wellness breathing and
like the Calm app?
Calm app, yeah. And then we go into bucket number 2, which are presentation style, where maybe it's group education, and employees can take little nuggets or little pieces to put into practice in their own specific life and how that really talks to them. Third bucket being text therapy and coaching. And then fourth bucket is probably the most critical and impactful, is that digital counseling and the traditional therapy, because that's that more one-on-one guidance.
So this all sounds amazing. And like, I'm sure when people are listening to this, they're like, sweet, sign me up. But it's not that easy. And I think the first step would be to hire you to help explain this. And I mean, but it sounds expensive. It sounds like a lot of work. So what do they do next if they're interested in one of these solutions?
Sure. Yeah, we'll dive into each bucket. So that first bucket being those point solutions. So those are those app-based. And then some of those are free. So really, you can just inform your employees about it. Hey guys, here are a couple of mindfulness or mental health apps that you guys could try out on a free basis, and give them those tools and resources, list them out, maybe a little blurb about each one of them. And then some of those apps, such as Calm, they do have corporate membership rates. So an employer can call and say, I would like to access 100 codes for my employees, pay for all of those 100 codes for an annual basis at a discounted rate, and then be able to just provide those codes with their employees. So maybe they're not getting the free version with all of the additional ads and maybe not all of the extras to it, but they get the actual paid version at no cost to them. Maybe they're more likely to access it when needed.
Yeah. So what type of therapy or help do they get with an app like Calm?
Yeah, more so for like mindfulness, maybe if somebody has trouble sleeping, maybe if they want to read about stress and anxiety, they're not ready to take that step into talking with somebody about it, but they just want to learn, like, hey, I feel like this connects with me. Maybe I do have anxiety. What can I do about it just on my own?
Kind of a self-discovery, self-awareness.
Self-guided is what I like to call those point solutions.
So, so they get, that's going to help a lot of people that are just having a bad day, maybe need to be centered under some stress. What does then the next level you go up to? What is?
Yeah.
Bucket 2.
Bucket two. That's where we like to call that presentation style, those group coaching sessions, really. And not so much coaching, right? It's just education coming at them. And those can be done in person or virtual. We're seeing many employers that like to do this as a virtual option, where it's a Zoom link and everybody can log in as they want, and maybe it's recorded and then sent out after. In person, we're finding it less and less, partly because this is It's a topic where it's like near and dear to people's heart. They don't always want to be sitting next to somebody being like, yeah, I have anxiety. Do you?
Hey, buddy. Yeah.
So we're seeing more so of the presentation style in the virtual option. And really this is a organization that comes in and they have a presenter on this topic. They're usually 45 minutes to an hour long, and they can be recorded and then saved and sent out afterwards.
So I know you had a lot of different levels to help explain this, like how long it'll take to implement. What are the steps to do to get there? So can you explain how someone would get that started? Would they reach out to you, or would they find their own vendor, or how does that work?
So our team, the EHL team, Empowering Healthier Living at McGohan Brabender, we are here to help guide them. So depending on that bucket, so let's call it the presentations bucket is what they're looking for. An employer can come to us and say, hey, we would really like maybe a 3-part series of mental health presentations. How do we get that started? So the first thing we like to ask is like, what area are you located? And we have many local hospitals in each area. So in the Cincinnati area, Tri-Health we work with. In the Dayton area, Premier and Kettering. In the Columbus area, Ohio Health. So these local hospitals have really started to focus on mental health presentation styles. Okay. So we would first reach out to those if that's what they were looking for from a hospital. We would get pricing, we would get availability of when they would be able to speak and present this to the employees. But then we also have wonderful vendors that are outside of the hospital system, because some organizations like to make sure that they're not necessarily promoting one brand of a hospital.
Right.
So different vendors have either just one presentation or, like I mentioned, 3-part, 5-part series where it's an ongoing presentation where they're learning more and more for each subset.
And in the buckets, would you say, so the texting therapies and those point solutions are probably the cheapest, right? And then is this presentation level more affordable for a smaller organization, or?
Yeah, usually the price range is between $200 and $350 for a presentation style. So that is a very reasonable cost, and especially when you're maybe adding on a 5-part series, the cost for each presentation goes down. So if you are an employer that thinks that providing at least some sort of educational tools and resources in that presentation style, this is the one place where I feel is valuable at the low end cost.
Got it.
Yeah, and really that excuse me, that second level is, you may think, well, why don't they just go out and look it up on their own and find it? And I think sometimes there are people where they're not going to take that step on their own, but if you offer it to them, you're kind of holding out a hand for them.
It'd be hard to
take.
Resist if it was in your conference center. Yeah.
Plus I think culturally it shows the organization understands that the pressure points that you're facing, and that they're committed to helping not just your, through the benefit plan, not just your physical health, but your mental health.
Yeah, and we hear that quite often of employers that say, culturally, I just want my employees to know that we care about this. And if that's what you're trying to build, and build that culture, build that brand, and build that awareness, the presentation style is that affordable, in your face, just want to provide this, you can choose to participate or not type of situation.
So are we ready to move to the third bucket now?
Let's do it.
Yeah.
Okay, what's the next option?
Sure. So that third bucket is where we talk about the text therapy and coaching piece.
Okay.
So some things about text therapy and coaching, and what's really valuable about this is those access to text therapy is 24/7.
Okay.
So we have seen this particularly very important for those organizations that have a 24-hour workforce.
Okay.
Most commonly in fire departments, police departments, people that are actually working in the critical scenes that are helping other people that need help and guidance themselves.
I didn't even think of that.
Makes perfect sense.
Yeah, and they don't always take the time for themselves to say, time out, I need a mental health break. I am just getting off a 24-hour shift where I've worked very hard with caring for all of these people. I am drained. Like, what do I do next? And so a lot of these text therapy, 24/7 access is a great support line. So I know it sounds a little bit funny of text therapy, but when you are texting with this person, it is a licensed mental health therapist. So
It almost feels too easy.
Yeah,
Like
so
you're
it's not
texting
someone
your
that
mom.
just had 2 weeks of training
Yeah,
and
no.
no qualifications. It's a
Right.
true professional.
It is a master's licensed mental health therapist that you are connecting with on the other line. And it could be as simple as, I'm just getting off a long night of work and I'm exhausted, I'm drained, I have to go home and work with my kids. My child is having this problem. Where do I even start? Where do I begin to like calm down, take breaths, talk through this situation? And so that mental health therapist on the other end is there to provide that support, that guidance. And then if it was ever to be as critical as needing to move on to the EAP or the medical plan, these vendors have access to your employer's medical plan and EAP information on the back end, where they can guide you to that specific phone number for additional counseling if needed.
Question, let's say you do have this moment where you need to text someone immediately. What if you needed to continue the conversation with that same person? Is this an option that can happen, or would you just always be assigned to a new therapist?
Yeah, so in that moment, you are going to be connected with that same therapist for that, we call it maybe that specific critical incident or that solution. Now, if you were to text back 3 days later, you're probably going to get a different mental health therapist, so it's not going to be that same person. And there's no control over that, right? So you just have to, on the back end, they say, hi, my name is Shelly. I'm a licensed mental health therapist. What can I help you with?
Right.
And the next time it may be, hi, I'm Dan. I'm a licensed mental health therapist. But when they guide you along, it's the same sort of guidance that you're learning from them.
And they would probably have access to the last time you reached out,
yep,
right?
Correct. So they keep histories on the back end, so that way they can make sure that they understand what was talked about previously. They can do some follow-ups. Like, I recognize that last time you just wanted some calming treatments. Well, this time you have a more serious incident with your child, so let's talk through that. And so they have that past history of the conversation.
And the access is so much quicker, especially when they're in need of someone, because I know the average wait, even in this area in crisis situations can be 3 weeks.
2, 3,
Yeah.
4 weeks, absolutely.
And so when you need someone, they're only a couple thumb clicks away, which is great. So what happens in those situations where they're having a conversation, they're texting back and forth, and the professional says,
we need to escalate
this person is in a crisis situation. How does that work?
So there is always that that option of this crisis. We need a moment. They will inform the employee of, it sounds like you are in a critical need element. I am going to connect with 911. I'm going to connect with X person to get you immediate help right now at this moment. So that is always said up front, and then it is done on the back end from that vendor who is taking care of where that person is located, maybe the harm that they are doing to themselves at that moment. So that critical needs assessment is happening at that time.
And as a millennial, I really like the idea of text therapy. It sounds like it would be pretty appealing to my generation and Gen Z, whatever. So do you have any success stories that you're able to share?
Yeah, there's definitely been some moments that I've heard where maybe a mom is the employee and she knew of this resource and access that she had from her employer. So she texted out and just reached out and said, hey, I'm not necessarily having problems for myself, but my daughter has talked to us about potential harm or suicidal thoughts. I don't even know where to begin. What do I do?
Right.
So what is so positive about that experience is that that employee understand this resource that was in her toolbox, and she could reach out to not only help herself, but her family. And so that therapist on the other end was able to say, here are immediate solutions that you can help your daughter with right now. And then here are some long-term solutions. Let's get you connected with a counselor that she can see on a regular basis. Maybe it's in-person or inpatient solutions that they needed to hear and see and do. And because they have all of the medical and the EAP information on the back end, that employee in this critical time didn't have to go and do all of the digging, the research, the phone calls herself. They're able to guide her to those specific places.
So you were just using the example about the mother and the daughter. Does the daughter also have access to this level?
Great question. So almost all of these vendors are on a PEPM rate, so per employee per month rate, but it actually includes spouses and dependents as well within that rate. So yes, all access to the entire family for all of these solutions, these texting solutions.
Yeah, and something I just thought of as you were going through that, there are different people, different needs, different personalities. Kenzie may text in and want to speak with a female. If my child would text in, they may want to speak with somebody very specific. Can you like give a profile, or do they try to vet you and match you up with the right type of person? Or
that's a great question. For the texting side of things, I'm not as sure on that piece. But when we move into the traditional therapy and in-person therapy, that is absolutely a key piece of what you can move towards.
So in that level, it's kind of speed and access to care trumps the complete customization, which seems like it's the next tier.
Yeah,
what a nice segue. So the fourth tier, we're calling this the traditional counseling, correct?
Yes, correct.
Is it probably in person, I would imagine?
Yep. Traditional in person or now virtual therapy has become a big thing since COVID as well. So to Dave's point earlier, we have partners with many vendors that have access to be able to put specific requirements around what they want to see in a therapist. Certain gender, certain ethnicity, maybe different backgrounds of LGBTQ. All of those elements are able to be filtered out within those in-person counseling and or digital counseling.
Wow.
And what's really great that has come out of COVID, I hate to say that, really great out of COVID, but because this conversation around mental health has become so big, access has become faster within the digital world. So in the past, as Dave mentioned, sometimes in your local area to get an appointment with a counselor, it could be 3 to 4 weeks out. Is that problem still there? Yes, probably. But you're trying to hide it away or forget about it in that 3 to 4 week waiting time frame. Well, there are now vendors out in the marketplace where if you are okay seeing a counselor virtually, they can guarantee an appointment within 24 to 48 hours. But they also have that back end piece. If you say, I really want an in-person therapist, they will get you an appointment within 5 business days of seeing a therapist. And what's great about that and how that works on the back end is that these vendors are contracting and paying these therapists to make sure that there's availability within their schedules to see their specific clients within that quick turnaround time.
Right.
The 5 days may seem like a long time, but in the
realm of
in the world of behavioral mental health, that is unbelievably quick.
Yeah, and especially since some of these options could be on an unlimited basis of how many times you can have appointments. Now that is the higher end of the cost price point. So maybe if you need that quick virtual therapy session in 24 to 48 hours, you have that, but then you also have your next appointment scheduled for in-person in 5 days.
Right.
So that's the great thing about these different options that are available.
And you supplied us with a very handy dandy graph that we will also be sharing with our listeners, but it included, price, how long it takes to implement, how much administration is needed. And this fourth bucket feels like that has the most for all of those categories. Can you share the details on those?
Yeah, this fourth bucket is a higher price point, and part of that is because it is that what we like to call on-demand service, right? You're getting it fast, in person, virtual, so you're having to connect with that other human being right then and there, and that's their time. So there's a price point to those pieces, that on-demand piece. But in an employer's eyes, if they are able to help their employees and their families that quickly and that useful, then it's worth every dime of that.
Right.
So I think this bucket maybe takes that special employer that is truly dedicated to this, but if that's what you and how you want to build your organization and your culture, then there are those resources and those vendors out there for that.
Yeah, and it almost seems like with the stair step, you can do the crawl, walk, run approach, and it is an investment. But when you look at your overall healthcare spend, so much of behavioral health impacts claim costs.
Of course.
It's,
Yeah.
it leads to other additional medical problems. So, but it's not just the really big, really, the I don't want to say the larger self-funded companies or whatever. You can be a smaller mid-sized company and put the full-blown counseling in there.
Yes, or you could start with presentations to see how well received it is within your organization. So maybe at that lower price point, start with that. If it's really well received and your employees give great feedback, then let's keep moving forward with other solutions.
And on the HR side, how hard is it for them to get this implemented? Or is it pretty easy if you have a team like an EHL team guiding you there? Or is it just shopping out different vendors? Or how hard is that for the HR?
I would say for the HR team to come to our team and have these conversations of which direction to go first. We take that heavy lifting off your plate. We provide you those recommendations of the vendors to utilize. We provide you with that specific price point based on how many employees you have, how many spouses, all of the criteria within your organization. And our team is here to help with that heavy lifting. We want to make this as easy and smooth of a process for you as the HR team or the CEO, CFO team, because we know you have so many other things on your bucket that we just want to be able to provide the employees these resources.
Right.
Yeah. So it seems like we branched into a new realm. There are all these different point solutions for specific conditions: diabetes care, sleeping disorder problems, prenatal care. It seems like we got a point solution for everything, but it was like for the longest time, mental health, people looked at that and said, "Oh, that's just part of your EAP, or it's part of your medical plan." And what they realized was, because it became a very public topic where people were able to talk about it openly, other people didn't feel they needed to hide it, and then you had a global pandemic. You've got a lot of stress with the economy. It's like the perfect storm that faces us right now. Just going with the generic, well, it's in our medical plan or EAP, doesn't fly anymore. We're not suggesting, or I'm not suggesting, that you need to jump to that fourth tier, but if you don't at least start to treat mental health as a separate but equal part of your medical, what's your opinion? What's going to happen?
Yeah, I think that's where we are going to go into this crisis and then keep falling in that employee workforce shortage. We are losing employees every day because they are burned out, they have anxiety, they have depression, they have these mental illness. And if we as employers are not able to show our employees that we are here to provide resources and help, we're going to lose those great employees that we have.
And so on the other side of this too, let's say they are thinking about implementing this, they're not quite sure that maybe they can't invest in it yet, but HR wants to help. Do you have any tips or suggestions for them? Because, you want your employees to be happy and working, but sometimes they have to take the day off. They need a mental health day. How does HR prove that they're there for them, or that they want to help, and what can they add to do that?
Yeah, I would say starting with building that culture. So making it okay to send out guidance and tools and resources about mental health. Maybe those statistics, or maybe, hey, here's the Calm app. It's a free thing, but just learn about it, download it, try it yourself. And making sure that it's okay to have this conversation in the workplace. I think that that's first and foremost. And then back to the communication piece, the more and more we are able to communicate to the employees that there are a lot of resources out there, we want to help guide you, then the employees are more willing to go to that HR team to talk about it.
And we did something at MB, the new 988 line. We worked with HR and we wanted to make sure we sent that out, and EHL we made a graphic and we're like, reminder, 988 is now available if you're having a mental health crisis. And something as simple as that, to just show that we're aware, we understand, and we want you guys to know there's options out there too.
Yeah, and I'm sure that we'll have that as a different topic for a future podcast, because we'd love to have you back and just dig deeper into different areas. But we launched a really enhanced, robust mental health benefit to our employees at our last employee meeting, and it was an emotional topic for a lot of people, and it was one of those things that I think if you had that conversation with employers 10 years ago, it would be a much different reaction. It would be a hidden, guarded reaction, but there were a lot of smiles, there were hugs, there were
tears,
some tears,
lots of tears,
because they feel like, oh my gosh, we now have an avenue for us,
guidance,
for our family members, for the people that are most important.
Yeah, I think what's so important is that mental health is so personal. Everybody's journey is so different. Somebody may think that their struggles are not as important as others because they've heard other stories, but every struggle is just as important. I think what's the most critical piece is figuring out, how do you personally overcome that struggle? So is it through the avenue of texting? Is it through the avenue of just getting the information fed to you through a presentation? Or is it that avenue of in-person counseling? And maybe that leads to inpatient care. Everybody's journey is different, but as long as you understand individually how you can overcome it and become better at the end, then that's what we want to see in here.
It could save a life.
Absolutely. So we dumped a lot of information on our listeners today. Is there anything you wanted to end off on that you want people to know about this?
I think that it's just important to be aware that mental health struggles are in the workplace. And so as employers, let's be able to provide as many tools and resources as we can to our employees to make sure that they are happy and healthy for they're at work and present at work, but also at home with their families.
Yep.
Right.
Well, we appreciate you and everything you do for our company and for our clients. And thank you for all of your knowledge, our little mental health expert in-house. We are going to provide all of this information in flyers and PDFs, and we want to make sure that you guys are well equipped with this information too. So if you have any questions or comments, or if you want Tiffany back on the podcast, you can email me at kenzie@healthierbirthdays.com.
Or Dave at healthierbirthdays.com.
Yep. So thanks for joining us on Side Effects, and we will see you next time.